Hi everyone, welcome back to my channel. If you're new, my name is Joy. If you're returning, you already know what it is. Thank you for rocking with your girl, okay? And I know y'all seen the title, and I just been on a hygiene kick, so we're gonna get all the hygiene out the way. It's gonna be summertime. I'm trying to put y'all on everything, okay? Everything. And y'all want to see some skin, but baby, I just got out the shower and we gonna be real close up. For most of you that are new, or if you don't know, I am a dental assistant. I am an orthodontic assistant. 3 years of experience, okay, most of the dental stuff I have on my page is to help other dental assistants, but since we was on a hygiene kick, I'm trying to put y'all on everything. Y'all, I'm just sorry, I just got out the shower, so I'm playing in my hairline. But I just want to give y'all some hygiene tips, just things to do. I know a lot of people are scared of the dentist, and I understand why. However, you honestly just need a good doctor. You need somebody that cares about your oral health more than they care about making money, because a lot of dentists are in it for the money, just like doctors, and they're not in it for the overall health and well-being of their patients. I got into the dental field because I had a good pediatric dentist growing up, and I had a good orthodontic experience growing up. I did not have a bad experience at all with my, I didn't have a bad dental experience at all growing up, okay? And then I absolutely love being a black girl in the dental field because there's not many of us in it, and it's so rewarding, so rewarding. And when I say it's rewarding in a way that if you're black, you would only know, because when little black kids see me, I can tell that their guard is down, like they feel safe and comfortable. When black adults see me, I can tell they're like, okay, she gonna let me know, I'm gonna be cool here. And so I make sure that as a dental assistant, orthodontic assistant, I make other patients feel comfortable, and I also talk to them as a patient, but as if like they know me. I don't ever want it to feel very like strangerish, like, So with that being said, if you guys have any dental questions, just personal related, you can always DM me on Instagram. I respond back all the time. It may take me a little bit because I'm not on Instagram much, but I will get back to you within like 3 days at the most. So yeah, if you have any questions, let me know. If it's just braces related, just teeth related, I'll be glad to answer your questions. So we're just gonna get right into the video. So in terms of your oral hygiene, it is so important, like so important to take care of your oral hygiene. Your oral hygiene affects your overall health, and I cannot stress that enough. Like, and y'all know little kids are germ magnets. People put their hands in their mouth, they're touching stuff, you're touching doors, you're not washing your hands, you might have just slipped and forgot, whatever the case may be. But I need y'all to wash your hands, and I need y'all to brush and floss. If y'all don't do nothing else for me, if you don't follow me, I don't care what is going on with your life, please brush and floss and brush your tongue, okay? There are so many people that don't take care of their oral health, and it affects you along the lines. You do not want to be 30 years old or 25 years old having to get root canals and crowns and bridges or your teeth pulled out because you're not taking care of your oral health. If you have insurance, please go get you some dental coverage, okay? Or if they already have dental through your job, please go see a dentist. Look at the reviews. You can talk to the dentist. Dentists are also doctors. They are trained doctors. The only difference is they specialized in dentistry. All doctors are technically the same, except they have specialties. So yeah, number one, this is the order that I do it as a dental assistant, okay? Person to person, I'm letting y'all know, okay? You're going to floss first. I like wax. It doesn't have to be wax floss. Whatever floss you can get. This floss is from the dollar store, I'm pretty sure. You need to floss. Flossing, you're gonna floss. Let me just show y'all real quick since we're talking about it. The flossing is to get out any food and bacteria that are between your teeth. So I'm just gonna use some dental terminology here and like get y'all to understand as well, okay? So you're gonna floss and you want to make like a C shape, like you want it to be curved when you floss, because okay, that's just a demonstration. Your gums should not be bleeding. Let me just say that again. Your gums should not be bleeding. Did y'all hear me the first time? Your gums should not be bleeding. Okay? Blood is inflammation. It means that you're not doing it enough. It's inflamed. There's food, gunk, bacteria, the chicken nuggets you had, the tacos you done ate, the seafood boil you done had. It's hanging out in there. You ain't letting it out. So most importantly, you need a floss. If you don't do at nighttime, floss, because you need to get all of that food out before the next day, because you got hamburger, tacos, lasagna all up in there. Don't nobody want to smell that. And that's how you also help with morning breath. If you brush and floss at nighttime, your morning breath isn't going to be as bad as in the morning. So we went over the flossing. And so if you guys are wondering in terms of why they need x-rays at the dentist, let me just say, you get more radiation getting on an airplane than you do getting x-rays at the dentist, okay? And you get more radiation from the sun. I don't know why y'all be acting like y'all can't get no x-rays. Anyway, they take x-rays at the dentist because what it's called where your teeth touch is called contact or interproximal. So because you can't see visually through that with just a mirror or with your visual eye, we take x-rays. So preventing cavities in between your teeth, because if you get a cavity on one tooth, obviously they're touching, so you're going to get a cavity on the tooth next to it. So you want to floss. So that is why you should be flossing. That is why flossing is important. Now into brushing, a manual toothbrush is perfectly fine. I suggest you change your toothbrush out once a month, and also after you get sick. Really important. If you have an electric toothbrush, I have one. It's kind of hard to get into electric toothbrush because they be doing a lot, okay? It took me a while to get into it. Now brushing, you want to brush in circular motions. So I'm just gonna demo for you guys really quick. So in terms of brushing, you want to do circular motions. You also want to brush your gums. So you know how when you take a shower, right, you wash your whole body, the whole thing, okay? You need to brush your gums. Your gums are also included with your teeth. They're not separate, okay? All together. Now I'm also going to show you some more brushing. So in terms of brushing, you want to brush the inside, which is called the lingual. So the outer part of your teeth that we can see from your canine to your canine is called the facial side. From behind your canine to the last molar is called buccal, okay? Everything where your tongue sit is called lingual, tongue lingual, right? So you want to brush the lingual side of your mouth, and you also want to brush the facial side of your mouth. So that looks like, I'll do the bottom so you guys can see. can see that the toothbrush is at an angle. So you want to brush that angle. You don't need to be brushing aggressive, y'all. You don't need to be brushing aggressively. You just need to brush. That's all you gotta do, is just brush in general. Okay, you don't need to be brushing like you trying to do a slick back ponytail. You don't need to be brushing like you've been chewing bricks. You just need to brush. That's it. So along with brushing, you're gonna brush your gums like I said. So, and I'm telling y'all, you don't need to do this aggressively. You don't need to be aggressive. You're just cleansing. Like, if you were to take a towel and wash your body, you know, you might brush a little aggressive, but like brushing your teeth, you want to have like light to medium pressure. Okay, and then you're also gonna brush the roof of your mouth. I brush the roof of my mouth. I think everybody else should do it. Hey. And lastly, you need a tongue scrubber. If you don't buy this one, this is from Walmart. I believe it comes in a 2-pack. You can also get the tongue scrapers from Amazon. You need to brush your tongue. So you're gonna floss, you're gonna brush your tongue, right? So floss, right? Rinse your mouth out with some water, then go on with the toothbrush, toothpaste, brush everywhere. Okay, then you're gonna leave all of that toothpaste that's in there and go straight in with the tongue scrubber. The toothpaste and the tongue scrubber combo, win-win. Okay, your tongue should be pink. Your tongue holds and collects bacteria, germs, all of that. And so if you wonder why, or like how people can like smell your breath, 1, from flossing, and 2, because everything sits on your tongue. That's your taste buds, all of that. It's on there. Okay, I'm not saying y'all need to brush 10 times a day. As long as you brush in the morning, and at least at the bare minimum, this is basic. You don't want to do nothing. Brush in the morning, floss at night. Okay, now intermediate, right? You brush it in the morning, you use a mouthwash. Nighttime, you floss and brush, right? And you're brushing your tongue. Tongue is included in beginner and immediate. Now advanced, you got the electric toothbrush. You flossing and brushing in the morning, flossing, brushing at night. When I say brush, y'all, the brushing your tongue is included. Okay, can't stress this enough. Now use whatever toothpaste you like. I really don't care. In terms of mouthwash and what, you know, I like the TheraBreath. This will have you minty clean. Dr. Bronner's clean. Okay, Dr. Bronner's peppermint clean. Okay, so that's it for the brushing and the flossing and stuff. Now just, you know, take it a little bit further. If you want to whiten your teeth, I might do a separate video, I don't know yet, in terms of whitening. I have this extra bottle of mouthwash. There's half mouthwash in here and half peroxide. Peroxide is the #1 agent in whitening. So you can either get the box of whitening from like Amazon or the Crest strips or Colgate, whatever brand, and you want to use the strips like every day until the box is gone. You don't want to take breaks unless it's too sensitive for your teeth. I would do every other day, you know, depending on your, if your sensitivity is like a 1 to 5, I would do every other day. If your sensitivity is like a 5 to 10, meaning like it's super sensitive, your gums kind of hurt, you know, cold, sensitive to cold and hot things, I would do once every, I would say 3 to 4, maybe 5 days, just depending on your level of sensitivity. The peroxide, I sometimes do this and I just do the peroxide. I rinse with some peroxide and then I brush immediately after with some toothpaste. You can do that, or you can put it in the mouthwash, either or, whatever works for you. And yeah, peroxide is the #1 agent in whitening. So find what works for you. You can do the whitening gel and you can do the clear trays, whatever works for you again. So Thank you guys so much for watching. You are beautiful just as you are. Make sure you follow me on Instagram at joigasm, on TikTok at joigasm, and I will see y'all in the next video. I appreciate y'all so much for sticking around.